U.S. Senate has passed President Trump's tax bill, which includes significant spending cuts, including Medicaid. Natalie Kutchko spoke to leaders from local agencies already preparing for major changes should the measure become law. Natalie, what did they say today?
Well, Teresa, the organizations that I heard from support a strong number of those supported by Medicaid here in Monroe County. They are bracing for a possible change in services with the hope that at no point in the future they will be forced to turn patients away. The Senate narrowly passed President Trump's major spending and tax bill Tuesday in a 51-50 vote that required the vice president to break a tie. Trump's plan includes significant restrictions on Medicaid, including cuts, new 80-hour-a-month work requirements for many adults on the benefits, and additional copay charges.
It's terrifying. It's terrifying because the folks that we serve, and we serve over 3,000 a year annually that come through our doors, both in our 24/7 open access, but also our outpatient treatment. Of that, about 85% rely on Medicaid to get the help that they need and they choose for themselves and deserve. It's a lifeline for them. And quite simply, I don't know what will happen to our community members that are seeking support if this bill goes through.
Jennifer Cathy oversees Delphi Rise, a Rochester-based treatment and recovery agency for substance use. Cathy cites a near 25% drop in overdose rates across the U.S. While it is a sign of progress, she says these cuts would only harm future care for those in need.
What could likely happen is that there won't be somewhere for someone to go when they're ready for help. They'll end up in the emergency department, which is far too costly and not the place someone deserves or needs to go when they require this level of help.
At Rochester Hearing and Speech Center, CEO Bob Russell highlights a 30 to 35% of audiology patients who rely on Medicaid. The uncertainty, he says, could result in a cut on services there, a primary local source for hearing health needs.
We've been sitting on a lot of conference calls with the National Council of Not-for-Profits and the New York State Council of Not-for-Profits, and the feeling right now is that this is inevitable. Something is going to happen. We just don't know how deep it's going to go or when it's actually going to take effect. We're just trying to make sure that we're staying on top of what's happening so that we can try and make any adjustments that we have to. Because the last thing I want to do is tell somebody, I'm sorry, we're not going to be able to see you, or we're going to have to put your care off further. That's not what they need to hear at this time.
Still a lot of uncertainty for local agencies at this point, and the bill now returns to the House for a new vote where it must pass in order for the president to sign this package into law. We will, of course, continue to monitor possible impacts on the local level and stateside as well. Reporting in studio, Natalie Kutchko, News 8.